The Sexual Violence Research Initiative is a global network of researchers, practitioners, policymakers and funders interested in issues around gender-based violence or violence against women and children and wanting to make a positive impact on that globally.
The aim of these projects is to try and prevent violence in childhood, because we know that if we can stop children growing up in toxic childhoods, that we can hopefully reduce perpetration and violence in adulthood. We're working in East Africa with 3 teams, 2 in Kenya and 1 in Tanzania, aiming to reduce violence in schools. And we know that if we do school-based interventions, we need to take a whole school approach. So we've been working with the 3 teams to identify what are the risk and protective factors within their school environments and identify programs that address those issues.
So our project is about carrying out intervention to reduce intimate partner violence for adolescent children aged 12 to 14. Adolescents face risks in school, on the way to school, and at home. So we needed parents to understand that they are very important as a form of support.
The joint session where the adults and learners were having a dialogue, that was the most exciting sessions, because this provided the opportunity for the first time, I guess, for learners to be able to communicate what is it that they feel about issues related to gender, issues related to communication, issues related to the expectations from their parents and teachers. And for the first time, the adults, they were able to get a sense of what is it that the learners actually feel and what is it they expect from them.
So the anecdotal feedback we got was very positive. Adolescents felt more comfortable to deal with conflicts that they face in schools and at home. They also felt able to start a conversation with parents without fear of parents asking, why do you want to talk about sex? Why do you want to talk about condoms and things like that? And the teachers also felt they learned alternative disciplining. You don't have to use caning, and also that the alternative disciplining methods could have longer-term positive effects for adolescents.
By listening to the stories of teachers, they are now more free for learners to disclose some of their experiences, which is something great, because we always knew that young adolescents do experience acts of violence, but they do not report. So we see them starting to report.
What is interesting about Kenya's project is our work with nomadic communities, which are known to be very difficult to reach.
We encountered 2 challenges. One was getting approval to undertake the study. And the second challenge was around just being able to address child abuse from a community that considers it okay for children to be abused or for children to be married off early. And how we encountered these was to have county-level engagement meetings with the education officials, so that then they gave us the go-ahead to implement within the schools. So the parents gave us consent to talk to their children from the research perspective and also to bring them into the workshops.
These are meetings bringing together parents, teachers and learners that explore the factors. What are these causes that drive parents to abuse children, and that cause teachers to abuse children, and that cause children to abuse other children?
So far, the key feedback, in as much as we are still implementing the project, we're looking at the number of people who've come for the workshops. Because remember, you're looking at child abuse from a community where it is normalized. We recruited 20 parents, and in all the sessions we've had the 20 parents sitting. We've had the children come in, there's been no dropout, the same with the teachers. And also having parents sitting in a session with their children, for me, it's a success story for us.
Our project has made a difference. We have seen communities that are beginning to be aware of what children mean to them, that the raising of children does not only take the family, it takes the entire society. We are beginning to see parents who are much more interested whether their schools are safe or not.
One of the key things that stood out for us is one of the chiefs who stood out and said, our children have been suffering because they have not been told, or they've not been explained to what sexual abuse is or how they can protect themselves. But now as a chief, I'm able to use my position to ensure that our children are safe in this community.
We have shared some of our findings with the Ministry of Education, and also this is influencing national policies. We are beginning to see that the national government and county governments are also interested in ensuring that the children are safe.
So we're implementing a program in Nairobi targeting 2 schools, three groups of participants, that is teenagers 12 to 14 years old, their parents and teachers. This program was aimed at having a safe space where parents and children could have a discussion. One of the key objectives was actually to teach teenagers to assert themselves. So kids actually came out saying that I've learned how to tell my peers or my parents how to talk to me or how they make me feel when they talk to me in the way that they do. In fact, I remember one dad who said that he felt very bad, especially when he learned what his daughter was going through. Once they had this kind of dialogue, he came to us and said, I now know what my daughter went through, and I wouldn't want her to go through that. And in fact, the school administration where we conducted this program called us later to say, we want to incorporate this program in our strategic plan of the school so that you are able to come more often and be able to talk to our parents and children about this, because we think this is a great program you're running.
Children and women suffer widespread violence, and the situation is much worse in the developing countries. And this is because violence is rooted within cultural norms and practices which are predicted on power imbalances between women and men. So the most promising way to address this violence is by making men to believe that they can be part of the solution. We designed a program which directly, explicitly targets men by recruiting men, first of all, into a men's-only group, and then encouraging them later on to join together with a women's group.
Normally we were thinking that the fathers would not easily discuss what is happening, but I was mistaken. I would see fathers coming each week discussing what they are going through in their homes, the challenges they are facing as fathers, the challenges they have as men. And so it was an opportunity for them to learn from their peers so that they can resolve some of their conflicting issues in their families. And it was the same opportunity also for the mothers.
We have had testimonies of women telling us that now their men listen to them. And in terms of how to relate with children, men and women have all been able to reflect on what corporal punishment does to children and to use alternative means, and children's behavior improves.
We're working with the teams in a number of different ways and at different levels. We have worked with them to identify what their technical needs are. So do they need help with developing research protocols, to develop and test interventions? So it's helping them to think through what is primary prevention and what type of things do we need to be doing to stop the violence before it starts.
They are partners, because when you think of a funder, you think of someone who is an outsider who will come and say, do this, but they are partners. They walk with you the road, they learn with you, and they guide the process.
So through emails, through phone calls, there have been frequent Skype calls for support to discuss issues, and as well they've visited us several times.
They have been able to travel to Kenya to assist us on various challenges it is that we have been facing, to address them together with us. They have also been of assistance in analyzing the information that we obtain.
We're working with them to develop tools, to see what other tools are being used elsewhere in the world and maybe adapt those rather than create new things from scratch.
The SVRI facilitated a number of workshops that involved the partners from different countries, and we were part of that, and we learned a lot on how to improve the design of our own programs.
I think that all of us are learning, and we really love the fact that people are really understanding that we can prevent violence by working with children, working with teachers, working with parents, working with communities, across all those circles that surround the child. And working together rather than separately in our silos, we can learn so much more.
So for us, what will happen next is to really put together a protocol for a randomized controlled trial.
If we get funding, we hope and know that we'll have an opportunity then to implement this manual and see if what we saw works here with the small group also continues to work with the larger group.
It's been really exciting, and the programs are showing really great promise. So from this piloting phase, we feel now it's ready to go to a full trial.
And we are so excited about the future simply because there's a new revelation to us that we can always use research to design interventions. That interventions that are based on research are more effective, they are more likely to bear results.